You're listening to the Dynamic Thinking Project podcast. This is episode 63, and today's topic is Morgellons. Hey everyone, Adam Muselli here. Welcome to the Dynamic Thinking Project podcast. If this is your first time listening, then thanks for coming. This podcast is released every Friday, and show notes are found at the website, themindtechinstitute.com. It's all one word. Come back often and feel free to add this podcast to your favorite RSS feed or iTunes. You can also follow me on Twitter and Facebook. All links are in the show notes and website. And now, let's get started. Since last episode, when I was talking about a fungus from the genus Ophiocordyceps, which it turns insects into zombie insects, and I mentioned something called Morgellons. Some people call it Morgellons with the heavy G or with the soft G as Morgellons. Since then, I've received emails asking me, what is Morgellons? And others asking me to talk about it. And this is what we're gonna do, but after we get the intro out of the way. If you are interested in learning and becoming a fully qualified hypnotherapist, neuro-linguistic programming, NLP, practitioner or master practitioner, a life coach or a counselor, now you can study all that online. All you have to do is visit mti.edu.au or themindtechinstitute.com and you'll find all these courses along with many other courses. Once you click on the online courses tab, all our diplomas and advanced diplomas are accredited and recognized worldwide. And for more information, all can be found online, themindtechinstitute.com. Now, why the interest in talking about Morgellons, and isn't it just like any normal disease? Well, not likely. Because Morgellons is something like a horror movie, and it reminds me of a movie called Body Snatchers. This movie is a remake of an older movie called Invasion of the Body Snatchers, and it's a good movie if you ask me. It's scary though. Anyway, so what is Morgellons? Simply imagine that you're feeling sick, and I mean really sick, with symptoms and physical symptoms. So you go to a doctor, or maybe doctors, and they tell you there is nothing wrong with you. It's all in your mind. So, what is that sickness? People describe it as the creepiest feeling. It feels like mites or something crawling in the skin. To later, that thing crawls out of the body, out of the skin. Some reported it looks like fibers, and others reported it's very small and it looks like black particles of some sort, and that is called Morgellons disease. Now, what is Morgellons disease? Morgellons disease is often viewed as a pseudo-medical disease by most medical doctors and also science in general. It is often viewed as delusional parasitosis, which is a delusional disorder that leads to the belief that someone has parasites or foreign material moving in or coming out of their skin, similar to drug users and meth users. However, Morgellons is a mysterious infection, and according to some researchers, this disease affects maybe millions of people around the world, and its symptoms are strange and scary. There are enormous skin lesions with multicolored fibers of red, blue, and green growing out of them, and you can easily find many photos of it on the internet, and you can also see some people actually extracting them out of their skin, those fibers. But here's the thing. According to the Centers for Disease Control and Prevention, CDC, Morgellons doesn't exist. And many doctors believe that Morgellons is delusional disorder, and those skin lesions are self-inflicted. Now, I do understand the anger and frustration of those who suffer from this disease, because the CDC says this disease doesn't exist, and doctors tells them it's all in your head. So it's not a good feeling to being categorized like that and then neglected. However, according to a doctor called Raphael Stricker, he says Morgellons is linked to Lyme disease. So, these fibers that are seen in Morgellons patients, they are not some worms or lint or something from outer space. What they are is they are fibers that are produced by the patient's own cells. And for some reason, these patients with Lyme disease overproduce these fibers, and then they come up through the skin and cause these weird lesions. So the bacteria that causes Lyme disease is called spirochete. It's transmitted by the bite of a tick, and there are actually some people, they said they started feeling this Morgellons, this disease and these lesions after a bite of a tick or mites. And Dr. Raphael Stricker, he also said that they looked at a number of Morgellons patients, around 25 patients that had skin lesions with fibers, and all the patients essentially had infection with Lyme disease bacteria. Now, Dr. Stricker might be right. It could be related to Lyme bacteria, and it could also be related to a bug bite. And in case if you don't know, there are some insects look for a soft skin tissue, such as wounds, to bite and empty out their eggs to later grow under the skin of human, animals, and other insects. And yet, skeptical doctors still argue that Morgellons is a psychiatric condition. They often diagnose patients with what they call delusional parasitosis and give them a prescription for an antipsychotic medication called Pimozide and send them home. And if you're wondering what Pimozide is, it's actually a medicine for Tourette's syndrome. And no wonder why most people who have Morgellons have formed a subculture in groups. And what makes this situation even worse is they leave the conventional medicine and science, and they go to quack doctors and other new age healers, which make them more prone to delusions and deceptions. That's why they feel neglected and moving from one failure to another. Why? Because despite all evidence of the existence of Morgellons, doctors still deny it. And actually that led many other people to believe that there is a big cover-up about Morgellons disease, and some people say it's caused by chemtrails, others say it's caused by the GMO foods and related to Monsanto products, and other people think that those Morgellons fibers are some form of nanotechnology and other similar theories. You see, when authorities pay less attention to something or deny it, in this way, they are forming these conspiracy subcultures, but unless if they are doing it on purpose as a psyop. Psyop is a psychological operation. So, what do we really know about Morgellons? According to a scientific report published by the U.S. National Library of Medicine in February 2018, and I'll include a link to that publication in the show notes, it says that Morgellons has a long history, and it was mentioned in a letter written in 1674 by Sir Thomas Browne, who was an English physician. And yes, the word Morgellons is mentioned in it. However, Sir Thomas Browne stated, and I quote, hairs which have most amused me have not been in the face or head, but on the back, and not in men, but in children." End quote. So, I think this is a different type of Morgellons because, of course, unless if only the word Morgellons is used here, but because Morgellons these days, people of all ages and all genders reported suffering from this disease. That's if you want to call it a disease. And actually, it's more frequent in middle-aged people than children. But also, of course, some children are suffering from it, but I think it's more common in middle-aged people. You see, in recent years, some people complain of skin infestation by either parasites or inanimate matter, along with related somatic complaints. People with such condition report poor or non-healing skin sores, which is the skin lesions, also reported itchiness and sensations of stinging, biting, and insects crawling on or under their skin as formication. And these people also claim that thread-like fibers are extracted from these skin lesions. And despite this condition having neither any established diagnostic criteria and treatment, nor any formal institutional recognition among members of the lay population. And to date, there are no solid studies examining risk factors that contribute to the development of Morgellons disease. But instead, much of our knowledge is based on case reports, case series, anecdotal accounts, and just a limited numbers of retrospective analysis done by some healthcare. And as in the case with many other diseases, more research needs to be done on Morgellons disease. Now, here are some typical characteristics of Morgellons disease, and that's what I found. I'm sure maybe if you are a medical doctor or you have studied some medical science, I'm sure you'll be able to dig out more. But what I found so far, the typical characteristics of people who complain from Morgellons disease include middle-aged, symptoms lasting more than 3 years, disability caused by this condition, comorbid psychiatric disease, and illicit drug use. And as I said before, that common complaints among people with Morgellons disease is that fibers can be pulled out of their skin as lesions. And in 2012, researchers examined 115 people with complaints consistent with Morgellons disease and found that on skin biopsy, lesions contained no parasites or mycobacteria. Instead, materials procured from skin usually consisted of cottons-like material mixed with pus, and skin changes were almost likely caused by scratching or insect bites. These findings seem to suggest that these fibers come from clothing. Now, that also makes sense because those fibers could be the result of accumulated fibers came from clothing and furniture and entered the skin through or even through hair follicles. Also, those fibers could be ingrown hair. And as we know that we have hair all over our skin, and even some little tiny hairs you can't even see without a microscope. They can also be fungi or some formation of dermofilaments. However, what makes me rethink about all these assumptions is that all the people who suffer from Morgellons reported that these fibers are alive. And yes, they are alive and they move even after they have been extracted out of their skin. And you can find many videos where people have pulled out some of these fibers, and you can see clearly how these fibers, they move even after they have been pulled out. Now, it is really hard to pinpoint exactly what is Morgellons, and I think no one knows what it is exactly, unless if it's designed in some military lab, of course, and there is no solid proof that I know of. But here's what I know. Without a doubt, people who complain from Morgellons disease suffer. More specifically, a majority of people with this condition complain of chronic fatigue, depression, and substance abuse. So, we need to raise awareness, because I have this gut feeling and lots of evidence to indicate that this is more than just a fungi or filaments or whatever it is. And to treat those who have Morgellons with psychiatric pills is really, really a coward move from doctors and clinicians, because it is proven that it does exist physically, not a placebo effect or a mental disorder or some self-infliction. I hope I will get more information about it, and I hope that if I can find a qualified medical doctor to talk about it on air, and I will certainly organize an interview with them on this podcast. And once again, if you would like to study and become a fully qualified hypnotherapist, a neurolinguistic programming NLP, life coach, or a counselor, now you can study all that online. All you have to do is visit mti.edu.au or themindtechinstitute.com, and you will find all these courses along with many other courses once you click on the online courses tab. All our diplomas and advanced diplomas are accredited and recognized worldwide, and for more information all can be found online, themindtechinstitute.com. That's it for today. Thank you for listening. If you have any questions, as usual, you can email me. The email is on our website, themindtechinstitute.com. And don't forget to like, share, and subscribe, especially if you are listening to this podcast on YouTube. The Dynamic Thinking Project podcast is released every Friday. Until next time, take care and enjoy your weekend. This is Adam Muselli, signing out.